Question 1. What is the generic name for the brand name drug Sterile? A. Metformin. B. Amlodipine. C. Lisinopril. D. Simvastatin. Answer: C. Lisinopril. This question tests your knowledge of common brand and generic drug names, which is crucial for recognizing prescriptions. Sterile is a brand name for lisinopril, a medication commonly used to treat high blood pressure and heart failure. Metformin treats diabetes, amlodipine treats high blood pressure and angina, and simvastatin lowers cholesterol. Remembering the generic name helps ensure you select the correct medication when filling prescriptions, which is a vital safety check in the pharmacy. A good way to study is to associate the brand name with its generic counterpart for the top 200 drugs. Question 2. A prescription calls for 500 mg of amoxicillin suspension. The available concentration is 250 mg per 5 milliliters. How many milliliters should be dispensed per dose? A. 2.5 milliliters. B. 5 milliliters. C. 7.5 milliliters. D. 10 milliliters. Answer: D. 10 milliliters. This question requires a basic dosage calculation to determine the correct volume of liquid medication needed for a specific dose. The prescription needs 500 milligrams, and the available suspension contains 250 milligrams in every 5 milliliters. To find the volume for 500 milligrams, you can set up a proportion or think that 500 milligrams is double 250 milligrams, so you need double the volume, which is 2 times 5 milliliters. A proportion would be 250 milligrams/5 milliliters equals 500 milligrams/x ml, solving for x gives 10 milliliters. This calculation ensures the patient receives the exact prescribed amount of medication, preventing under- or overdosing. Mastering these calculations is essential for safe practice. Question 3. Which of the following is an example of a Schedule II controlled substance? A. Alprazolam, Xanax. B. Codeine cough syrup. C. Hydrocodone combination products, e.g., Norco. D. Gabapentin, Neurontin. Answer: C. Hydrocodone combination products, e.g., Norco. This question tests your understanding of controlled substance schedules, which are based on their potential for abuse and dependence. Schedule II drugs have a high potential for abuse and severe psychological or physical dependence, requiring strict regulations like no refills and specific prescription requirements. While alprazolam is a controlled substance, its Schedule IV, codeine cough syrups are often Schedule V, and gabapentin is not federally scheduled but may be controlled at the state level. Hydrocodone combination products were moved to Schedule II, reflecting their high abuse potential. Knowing these classifications is critical for proper handling, storage, and dispensing according to federal and state laws. Question 4. What is the primary purpose of a laminar airflow workbench in a pharmacy sterile compounding area? A. To prevent contamination of the preparation from the surrounding environment. B. To keep the technician cool. C. To sterilize the medications being prepared. D. To humidify the air in the compounding area. Answer: A. To prevent contamination of the preparation from the surrounding environment. This question focuses on quality assurance in sterile compounding, specifically the function of essential equipment like a laminar airflow workbench, LAFW. The primary role of an LAFW is to create a sterile environment by filtering air and directing it smoothly across the compounding area, preventing airborne particles and microbes from contaminating sterile preparations. It does not sterilize the medications themselves, cool the technician, or humidify the air. Maintaining a sterile environment is paramount to patient safety when preparing intravenous medications or other sterile products. Always remember that the LAFW protects the product from contamination. Question 5. A patient presents a prescription for atorvastatin, Lipitor. What is the primary use of this medication? A. To treat depression. B. To lower cholesterol. C. To relieve pain. D. To manage diabetes. Answer: B. To lower cholesterol. This question assesses your knowledge of the common uses of frequently prescribed medications, specifically atorvastatin. Atorvastatin is a statin medication widely used to reduce high levels of cholesterol and triglycerides in the blood, which helps prevent heart disease and stroke. It is not used to treat depression, relieve pain, or manage diabetes. Recognizing the primary indication of common drugs like Lipitor is essential for verifying prescriptions and counseling patients appropriately. Knowing drug classifications and their main uses is a foundational part of pharmacy practice. Question 6. If a medication needs to be stored at refrigerated temperature, what is the typical temperature range in degrees Celsius? A. 0 to 2 degrees Celsius. B. 2 to 8 degrees Celsius. C. 8 to 15 degrees Celsius. D. 15 to 25 degrees Celsius. Answer: B. 2 to 8 degrees Celsius. This question tests your understanding of proper medication storage requirements, which is a key aspect of quality assurance. Refrigerated storage generally refers to temperatures maintained between 2 and 8 degrees Celsius to preserve the stability and efficacy of certain medications. Temperatures below freezing, 0 degrees Celsius, can damage some products, while temperatures above 8 degrees Celsius may also lead to degradation. Maintaining medications within their specified storage range is crucial for ensuring they work correctly and are safe for the patient. Always check the manufacturer's recommendations on the drug label or packaging. Question 7. A prescription reads, dispense number 30 tablets, take 1 tablet by mouth daily. What is the day's supply? A. 15 days. B. 30 days. C. 60 days. D. 90 days. Answer: B. 30 days. This question involves a basic calculation of the day's supply, which tells you how long a dispensed amount of medication will last based on the dosage instructions. The prescription provides 30 tablets, and the patient is instructed to take 1 tablet each day. Therefore, the 30 tablets will last for 30 days. Calculating the day's supply is important for billing, insurance claims, and ensuring the patient receives an appropriate quantity of medication until their next refill or doctor's appointment. It's a straightforward calculation, total quantity divided by the quantity taken per day. Question 8. The Poison Prevention Packaging Act, PPPA, requires most prescription drugs to be dispensed in child-resistant containers. Which of the following drugs is exempt from this requirement? A. Amoxicillin tablets. B. Prednisone tablets. C. Sublingual nitroglycerin tablets. D. Lisinopril capsules. Answer: C. Sublingual nitroglycerin tablets. This question tests your knowledge of important pharmacy laws and regulations, specifically the Poison Prevention Packaging Act and its exemptions. The PPPA aims to reduce accidental poisonings in children by requiring special packaging that is difficult for children under 5 to open. While most prescription drugs fall under this rule, certain medications, like sublingual nitroglycerin, are exempt for specific reasons, often related to the need for quick access in emergencies. Other common exemptions include oral contraceptives and certain corticosteroid dose packs. Knowing these exemptions is necessary to comply with federal law. Question 9. What is the brand name for the generic drug metoprolol succinate? A. Low pressor. B. Toprol XL. C. Inderol. D. Tenormin. Answer B. Toprol XL. This question requires you to identify the brand name associated with the generic drug metoprolol succinate. Metoprolol comes in two main forms: tartrate, often low pressor, and succinate, often Toprol XL. They are both beta blockers used to treat conditions like high blood pressure and heart problems, but they have different dosing schedules and brand names. Inderol, propranolol, and tenormin, atenolol, are different beta blockers. Distinguishing between metoprolol tartrate and succinate and knowing their brand names is crucial for dispensing the correct medication. Pay close attention to the salt form of the generic name. Question 10. Which route of administration involves injecting a medication directly into a vein? A. Intramuscular, IM. B. Subcutaneous, sub-Q. C. Intravenous, 4. D. Oral. Answer C. Intravenous, 4. This question assesses your understanding of different routes by which medications are administered to patients. The intravenous route specifically involves injecting the medication directly into a patient's vein, allowing it to enter the bloodstream immediately for rapid distribution throughout the body. Intramuscular injections go into a muscle, subcutaneous injections go into the fatty tissue under the skin, and oral medications are swallowed. Understanding these routes is fundamental to preparing and handling medications correctly and appreciating how they work in the body. Question 11. A pharmacy technician is reconstituting a powder medication. What is the most important information to check on the vial before adding diluent? A. The price of the medication. B. The patient's name. C. The expiration date of the powder. D. The prescribing physician's name. Answer C. The expiration date of the powder. This question relates to quality assurance and safe medication preparation practices. Before reconstituting any medication, it is absolutely critical to verify the expiration date of the powder to ensure the medication is still potent and safe to use. The price, patient's name, and physician's name are important in other steps of the dispensing process but do not impact the stability of the drug product itself before reconstitution. Using expired medication is a significant safety error. Always perform this check as part of your preparation workflow. Question 12. What is the abbreviation NPO commonly used for in medical contexts? A. As needed. B. By mouth. C. Nothing by mouth. D. Every morning. Answer C. Nothing by mouth. This question tests your knowledge of common medical abbreviations, which are frequently used on prescriptions and patient charts. NPO is a Latin abbreviation standing for nil per os, meaning nothing by mouth. This instruction indicates that a patient should not eat or drink anything, often required before surgery or certain medical procedures. As needed is PRN, by mouth is PO, and every morning might be QAM. Understanding these abbreviations prevents errors in administering medications or providing patient care instructions. Question 13. Calculate the amount of active ingredient in grams needed to prepare 500 milliliters of a 2% with V solution. A. 2 grams. B. 10 grams. C. 20 grams. D. 100 grams. Answer B. 10 grams. This question requires a calculation involving percentage strength, specifically weight in volume, with V, which represents the grams of solute per 100 milliliters of solution. A 2% with V Solution means there are 2 grams of active ingredient in every 100 milliliters of solution. To find the amount needed for 500 milliliters, you can set up a proportion, 2g/100 milliliters equals xg/500 milliliters. Solving for x, you get x equals 2 by 500/100 is equal to 10 grams. Accurate preparation of compounded solutions relies on these calculations. Question 14. Which federal law established the DEA, Drug Enforcement Administration, and categorized drugs based on their potential for abuse? A. Food, Drug, and Cosmetic Act, FDCA. B. Kefauver-Harris Amendment. C. Controlled Substances Act, CSA. D. Health Insurance Portability and Accountability Act, HIPAA. Answer, C. Controlled Substances Act, CSA. This question assesses your understanding of key federal laws governing pharmacy practice, specifically those related to controlled substances. The Controlled Substances Act of 1970 was the landmark legislation that created the DEA and established the scheduling system, Schedules IV, for drugs with potential for abuse and dependence. The FDCA broadly regulates drug safety and effectiveness, the Kefauver-Harris Amendment added efficacy requirements, and HIPAA deals with patient privacy. Knowing the CSA is fundamental to handling controlled medications legally and safely. Question 15. What is the generic name for the brand name drug Synthroid? A. Levothyroxine. B. Liothyronine. C. Methimazole. D. Propylthiouracil. Answer, A. Levothyroxine. This question tests your knowledge of brand and generic names for commonly prescribed medications, specifically Synthroid. Synthroid is a widely recognized brand name for levothyroxine, a synthetic hormone used to treat hypothyroidism, an underactive thyroid. Liothyronine is another thyroid hormone drug, while methimazole and propylthiouracil are used to treat hyperthyroidism, an overactive thyroid. Accurately identifying levothyroxine as the generic for Synthroid is crucial for dispensing the correct thyroid medication. Question 16. A prescription calls for ibuprofen 600 mg tablets, dispense number 40. The dose is take 1 tablet by mouth 3 times daily as needed for pain. What is the maximum days supply if the patient takes the medication consistently? A. 10 days. B. 13 days. C. 40 days. D. The day's supply cannot be determined from the information given. Answer, B. 13 days. This question requires calculating the day's supply for a medication with a as-needed frequency, assuming the patient takes the maximum allowed dose daily. The patient takes 1 tablet 3 times daily, meaning they take a maximum of 3 tablets per day. The prescription provides 40 tablets. To find the day's supply, divide the total quantity, 40 tablets, by the maximum daily dose, 3 tablets/day. 40 divided by 3 is equal to 13.33, which rounds down to 13 full days' supply. Calculating days' supply for PRN medications requires using the maximum daily dosage. Question 17. Which of the following is a critical step in preventing medication errors? A. Assuming the physician's handwriting is always clear. B. Relying solely on the patient to identify the correct medication. C. Performing a final check of the dispensed medication against the original prescription. D. Storing all medications alphabetically regardless of storage requirements. Answer, C. Performing a final check of the dispensed medication against the original prescription. This question focuses on quality assurance and practices that prevent medication errors, a paramount concern in pharmacy. A critical step in preventing errors is performing a meticulous final check comparing the prepared prescription label and contents to the original prescription. Assuming handwriting is clear or relying only on the patient can lead to mistakes. Storing medications alphabetically without considering storage requirements can compromise drug stability. The final check serves as a vital safety net before the medication reaches the patient. Question 18. What is the common brand name for the generic drug escitalopram? A. Prozac. B. Zoloft. C. Lexapro. D. Celexa. Answer: C. Lexapro. This question tests your recall of brand and generic names for commonly prescribed antidepressant medications. Escitalopram is the generic name for Lexapro, a selective serotonin reuptake inhibitor, SSRI, used to treat depression and anxiety. Prozac is fluoxetine, Zoloft is sertraline, and Celexa is citalopram. While these are also SSRIs, they are different drugs. Knowing the correct brand generic pairings for frequently used psychiatric medications is important for accurate dispensing. Question 19. If a medication is ordered stat, how quickly should it be administered? A. Within 24 hours. B. Within the next scheduled dose time. C. Immediately. D. At bedtime. Answer: C. Immediately. This question assesses your understanding of common medical order abbreviations related to timing of administration. STAT is a critical abbreviation meaning immediately, indicating that the medication is needed urgently due to the patient's condition. Orders like within 24 hours or at bedtime would use different abbreviations, e.g., daily, QHS. Recognizing a STAT order signals the need for immediate action in preparing and delivering the medication. Always treat STAT orders with the highest priority. Question 20. According to federal law, how long must prescription records be maintained by a pharmacy? A. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer: B. 2 years. This question tests your knowledge of federal record-keeping requirements in pharmacy practice. Federal law, specifically regulations under the Controlled Substances Act and others, generally requires pharmacies to maintain prescription records for a minimum of 2 years from the date of dispensing. State laws may require a longer period, and pharmacies must comply with the stricter of the two. Proper record keeping is essential for audits, refills, and legal compliance. Always be aware of both federal and state requirements. Question 21. A pharmacist receives a prescription for insulin detamir. What type of insulin is this? A. Rapid-acting insulin. B. Short-acting insulin. C. Intermediate-acting insulin. D. Long-acting insulin. Answer: D. Long-acting insulin. This question requires you to classify a specific insulin product by its action profile, which is crucial for counseling patients and ensuring proper use. Insulin detamir, known by the brand name Levemir, is a type of long-acting insulin designed to provide a steady release of insulin over many hours, typically once or twice a day, to control blood sugar levels between meals and overnight. Rapid-acting, e.g., Novolog, short-acting, e.g., Humulin R, and intermediate-acting, e.g., Humulin N, insulins have different durations of action. Knowing the categories helps you understand how the insulin should be timed relative to meals. Question 22. What is the beyond use date, BUD, for a non-aqueous compounded preparation? A. Not later than 6 months. B. Not later than the earliest expiration date of any active pharmaceutical ingredient, API, or 6 months, whichever is earlier. C. Not later than the expiration date of the shortest-lived ingredient. D. Not later than 14 days when stored at controlled cold temperatures. Answer B. Not later than the earliest expiration date of any active pharmaceutical ingredient, API, or 6 months, whichever is earlier. This question relates to quality assurance and compounding standards, specifically determining the beyond-use date for non-aqueous preparations. According to USP less than 795 guidelines for non-sterile compounding, the bud for a non-aqueous preparation is limited by either the earliest expiration date of any ingredient used or a maximum of 6 months, whichever time period is shorter. This ensures the stability and potency of the compounded product. The 14-day rule applies to water-containing oral preparations stored in the refrigerator, and simply using the shortest-lived ingredients date isn't the complete rule. Question 23. Which calculation is used to determine a child's dose based on their body surface area, BSA? A. Clark's rule. B. Young's rule. C. Fried's rule. D. The BSA formula often involves the child's height and weight. Answer D. The BSA formula often involves the child's height and weight. This question tests your understanding of methods used for pediatric dosing calculations. While Clark's, Young's, and Fried's rules are older methods based on weight or age, modern pediatric dosing often utilizes body surface area, BSA, calculations, which are considered more accurate as they account for both height and weight using specific formulas, like the Mosteller or Dubois formula. Dosing by BSA provides a more precise estimate of drug distribution and metabolism in children compared to age or weight-only rules. Always follow established protocols for pediatric dosing in your practice. Question 24. What is the primary role of the State Board of Pharmacy? A. To prosecute individuals who violate federal drug laws. B. To regulate the practice of pharmacy within the state. C. To negotiate drug prices with manufacturers. D. To represent the interests of pharmacists nationally. Answer B. To regulate the practice of pharmacy within the state. This question assesses your understanding of the regulatory bodies governing pharmacy practice. Each state has a board of pharmacy responsible for protecting the public by regulating all aspects of pharmacy practice within that specific state, including licensing pharmacists and technicians, inspecting pharmacies, and enforcing state pharmacy laws and regulations. The DEA handles federal law enforcement. Drug price negotiation is typically outside the board's scope, and national interests are represented by professional organizations. Understanding the state board's role is crucial for practicing legally and ethically. Question 25. What is the generic name for the brand name drug Norvasc? A. Lisinopril. B. Amlodipine. C. Metoprolol. D. Atorvastatin. Answer B. Amlodipine. This question tests your knowledge of common brand and generic drug names, specifically for a frequently prescribed blood pressure medication. Norvasc is a brand name for amlodipine, a calcium channel blocker used primarily to treat high blood pressure and angina, chest pain. Lisinopril is Zestril/Prinival, metoprolol is Lopressor/Toprol XL, and atorvastatin is Lipitor. Knowing that Norvasc is amlodipine is essential for accurately identifying and dispensing this common cardiovascular drug. Linking brand names to their generic counterparts is a core memory task for pharmacy technicians.